All right, guys, welcome back to our next installment of this or that. I forget who's this, who's that, but we're talking all things abdomen today. And so let's start. Gilbert?
Yeah, so wanting to start off with some non-surgical treatment options for maybe some of those small, little, tough to treat, stubborn areas where we can really reduce some fat volume. We can actually use a couple different treatment modalities non-surgically, from Kybella, which is our injectable fat dissolver, to Eon, which is our fat reducing laser, essentially. And basically it targets just a small area where maybe we have a little stubborn area, and that laser energy, that heat kind of penetrates through the skin while keeping the surface of the skin really nice and cool with some air that's just kind of jet propulsion down, just really nice cool feeling, and then that heat energy dissolves the fat underneath.
Yeah, and it works great, but like Gilbert said, it's really intended for smaller, like focused areas, and I've even used those myself, like to treat patients. But let's talk about liposuction. So, you know, going kind of more invasive, just under the skin, of course, not inside the abdomen, but using this cannula, what we can do is we can remove large amounts of fat. I mean, you can remove up to 5 liters at one time, but if you're talking stomach, usually you're moving a lot less than that, but it can make a huge difference. Those exercise resistant areas are the key though, those areas that you can't lose on your own. This is gonna help us do that. And of course we can do some definition, things like that with this, which, you know, we love doing. And next, we're talking about loose skin.
Yeah, so moving on to skin laxity. Non-surgically, we have the option of using this PLLA surgical thread or PLLA thread lift, essentially. And so PLLA stands for polyl lactic acid. It's the same exact component that is made out of, that sculpture is made out of, I should say. And so essentially what we're doing is we're using these threads to kind of help just pull up some of that skin laxity, just really make things nice and smooth, and help turn that sad belly button into a happy belly button, just kind of pulling up some of that excess skin.
Yeah, and it works really well. And honestly, we use that in surgery sometimes. We'll do liposuction. You've got deflated skin. You can use that to sort of make that sad belly button happy, like Gilbert said. But we also love using Renuvion. And we've got some great new data that shows, you know, the amount of Renuvion that we need to use to get a great result. And so we've been using those numbers with really excellent success. But this is, again, our Harry Potter wand, goes under the skin just like that liposuction cannula, zaps it, uses RF energy to help build collagen over time, so you get a quick tightening and a slow tightening that happens over several months, 6 to 9 months is what I've seen. And then we've got
some additional skin tightening treatment options in the form of energy-based devices. So in this category, we have our laser, which is our Avava laser, our ultrasound therapy, which is Sofwave, and then microneedling. And all these 3 different options, what they're gonna do is they're gonna help stimulate some collagen production in the dermal layer of the skin, which is that layer of skin just below what we can see on the surface. And that collagen is really gonna help kind of tighten things up, help create some support. So areas where we have maybe some skin laxity on the face, actually we're talking about the abdomen, sorry. So skin laxity on the abdomen can help kind of tighten that up and make things really nice and more fit and fabulous and athletic looking.
Right, but all these apply to the face too, really almost anywhere over the body, which is pretty cool. But we've also got Quantum, which is kind of this and that.
Yeah,
we both
like
kind of do this.
This and that.
Yeah.
And so Quantum is RF energy, so radio frequency energy, but in a sense it's a little bit more like the Renuvion that you're talking about, because it is something that we can introduce underneath the surface of the skin, which is really going to get to that dermal layer where that collagen is being made a lot easier without having to penetrate through the outside of the skin. We can actually get it in underneath the surface of the skin, really promote that skin tightening with a much stronger and more aggressive approach.
Right, and it's different than Renuvion, let's just be clear. It uses RF energy, but in a different mode, so people have a different response to it. So it's kind of important to keep that. It's not just Coke or Pepsi, it's almost a completely different animal. But coming down to, you know, maximally invasive, basically, you've seen me do lots of fleur-de-lis now. We just have so many people losing lots of weight, but you've got your traditional tummy tuck, you've got your reverse tummy tuck, you've got all sorts of things, even a mini tummy tuck, which I've done successfully with someone just laxity, no extra fat, where we basically just raise up the skin and we close that diastasis, that separation of the muscles. So there's lots of really, really cool things we can do to kind of fit your goals in your unique situation, especially with surgery, but it's maximally invasive. So it's like full power, maximal change, but also a little bit more recovery. And so you just find what fits for you. And the best way to do that is to come in and talk with Gilbert or myself.
Yeah.
All right, bye guys.